DREAM platform is another very exciting platform. It's very interesting because in a sense it's sort of different, obviously, because it's a monoclonal antibody targeting BCMA, but it has a similarity. It's the delivery of a payload directly to the cell. So what happens with the antibody drug conjugate strategy is that you target BCMA and then you deliver this cytotoxic payload, auristatin, directly into the tumor cell. I think it's a remarkable platform, and what happens is it targets the BCMA, delivers the auristatin that's highly toxic to the myeloma cell. But what's fascinating is as the cell undergoes apoptosis, there's what's called basically the delivery of additional antigens to the immune system, because essentially the cell is disrupted and dying. And in doing that, additional immunotherapeutic response is believed to occur. And this is obviously to some extent a preclinical observation, but it's a very important concept that may be real in the clinic. What we've seen is with the use of what's called Belantamab, or GSK916 for short, is that this drug as a single agent combined with a minimal amount of steroid for pre-medication administered every 3 weeks. We saw in DREAM1 in a relapse refractory population, and this data is now published, that there was a 60% response rate overall in basically both IMiD and PI refractory patients, so classically double or triple class refractory. And when we looked at the daratumumab exposed patients, we saw a response rate of about 40%. So 60% in overall for a typical early phase trial, DREAM1, 40% in the dara refractory patients. That's an important signal, and it appeared to be durable as well, which is a key. And so as a result of that, we then launched DREAM2, and you may have heard from the recent press release by the sponsor, GlaxoSmithKline or GSK, that we met their primary endpoint.